16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahala. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
Good evening. We are back with yet another episode of BMC Global Live Al Hilal Health World, nothing but lifestyle. I am Jessila Mujib. This is a talk show exclusively with expert doctors of Al Hilal hospitals and medical centers. Radiology is a medical specialty that deals with imaging technology to diagnose diseases. To speak about the efficacy of ultrasound in radiology, we have with us Dr. Fariha Mahmood from Al Hilal Hospital, Sitra. She is a consultant radiologist with an experience of over 12 years. So, let us move on to the doctor and know more about the topic. So, doctor, welcome to the show.
Thank you
and
so
thank
much.
you for joining us today.
Thank you.
So, doctor, can you please explain about some imaging modalities you usually carry out in your radiology department?
Okay. So, the common imaging modalities which we frequently or in the routine carry out in radiology department, number one, X-rays, which include conventional X-rays as well as fluoroscopy, which also includes X-rays, and mammography. It also involves X-rays, and ultrasound, Doppler ultrasound, CT scan, and MRI. I want to elaborate something about fluoroscopy because most of the patients are unaware of this imaging modality. Fluoroscopy is the contrast based imaging modality in which we use contrast, which can be either given orally or through intravenous route to the patient, and then we start taking X-rays after various different times. The time is different in different examination viscera of the body. Like for KUB, kidney, ureter and bladder, timing is different. For gut, small bowel, large bowel, it is different. So, this is about fluoroscopy, and Doppler ultrasound is also of great value in radiology department because through this Doppler ultrasound we can directly visualize the vessels, we can study the velocities and some ratios through this Doppler ultrasound, and is of specifically it is of great importance in obstetrical ultrasound, that is during pregnancy. Okay, so this Doppler ultrasound in pregnancy, we usually do this Doppler ultrasound after 28th week of gestation. And through this Doppler ultrasound, we check the umbilical artery and MCA, which is middle cerebral artery, to see the feto-placental circulation, that the blood flow is adequate between the placenta, fetus and the uterus. It must be carried out in high risk pregnancies. So, what are these high risk pregnancies? These are if the female is giving the history of gestational diabetes, and especially giving the history of gestational hypertension and monochorionic twins, that is two pregnant fetuses in the uterus, but they are sharing the same placenta. So, it is of greater importance. Okay. So, by doing this ultrasound, we can actually evaluate the intrauterine growth restriction, or if there is any poor perinatal fetal outcome. So, we can take measures in time.
So, what are the circumstances in which we should go for ultrasound? What are the indications?
According to me and according to many radiologists, this ultrasound is the first line of investigation in most of the cases, but some of its common indications are to examine the uterus and ovaries in both pregnant and non-pregnant ladies, and to monitor the health and the growth of the fetus in subsequent months of pregnancy, to diagnose the major visceral disorders or diseases like that of liver, gallbladder, kidneys, spleen, pancreas, etc. For the evolution of thyroid gland, also becoming very common in these days, and patients, and I am happy that patients are becoming aware of this as well, to examine the genital and prostatic problems. And also for the evaluation of this blood flow, as I have already told you, on through Doppler ultrasound, and some ultrasound guided procedures like ultrasound guided biopsy and FNAC. FNAC is fine needle aspiration cytology. So, these are some of the common indications why we should do ultrasound.
Okay, doctor, what are the advantages of ultrasound over other screening modalities? Can you explain that for us?
Yes, there are few common advantages, that why we prefer ultrasound to perform first as than any other imaging modality.
Okay.
It is widely available. Number one and most important is this: it is widely available. It is almost, ultrasound machine is present in all the hospitals and the medical centers, even in the small clinics. But CT, MRI, mammography, like these things are hardly to find. And number two is easy to use, and cost effective. It is less expensive as compared to other imaging modalities, especially CT and MRI. Number three, it is extremely safe. It is without any hazardous effects, because it does not involve ionizing radiation. It involves sound waves, like I am talking, you are talking. These are the sound waves. We are not giving harm to each other. So, that is why it is of extremely important in obstetrical ultrasound, that we can frequently carry out ultrasound in subsequent months of pregnancy, from the very first day till the last day, without any teratogenic effects. Teratogenic effect means without producing any harmful effect for the developing fetus. So, I think the females, there is myth in most of the female patients. We are doing this, doctor has advising this ultrasound again and again. Is this harmful for the fetus? No, it is extremely not harmful for the fetus. You can do it very safely. Number four is this: ultrasound is important to tell the nature of the lesion, whether it is solid or cystic. Cystic means fluid containing or water containing lesion. Solid means compact lesion. Last of all, ultrasound also helpful to evaluate some soft tissue lesions, which we cannot can be clearly seen on these conventional X-ray images. So, these are some of the common advantages why we prefer ultrasound over other imaging modalities.
You mean there is no risk factors associated with ultrasound?
Yes, no risk factor is associated with ultrasound.
Okay. Even during pregnancy it is very safe?
It is very safe. It is the safest modality.
Okay. Doctor, we would like to know how radiology helps the medical science.
Okay. Radiology is actually, it is a dependent specialty. It is not an independent specialty. It is directly related to all other specialties. I always say that all other specialties, they have to pass through this radiology to make the definite diagnosis and for planning the treatment for the patients. A radiologist deals with the surgical problems, medical problems, pediatric, musculoskeletal and gynae ops. Radiologist has to deal with all these cases. So, it is totally 100% dependent specialty, and ultrasound is not helpful in diagnosis, but also in certain therapeutic procedures like aspiration of the fluid in case of pleural effusion, aspiration of fluid in case of joint effusion, aspiration of ascitic fluid, and if the patient has a large cyst which can be either in the abdomen or in the breast. So, under ultrasound guidance we can aspirate the fluid which will help to create some relief in the symptoms of the patient. It will relieve the symptoms to some extent. So it is helpful in this way. It is very helpful for the medical science, because without this specialty, other referring doctor cannot reach the definite diagnosis.
So we hear that many people with infertility go for ultrasound in radiology. So please explain.
Yes, ultrasound is the first line of investigation for the screening of infertility. Again, I will say that because it is safe, it is widely available. Whenever we start screening for an infertile patient, we just do the ultrasound to check the morphology of the uterus. Morphology means the shape of the uterus. There are different shapes of the uterus. It can be unicornuate, it can be bicornuate, arcuate, didal face and septate uterus. So we must tell the gynecologist that this lady has normal shaped uterus or there is some abnormality which can be easily detected on ultrasound. Next, for the monitoring of or for screening of infertility, we do ovulation tracking. Ovulation tracking is also called follicular study. It is done only on ultrasound because it is done on 3 consecutive days. Starting from 13th day of menstruation, we tell the patient, please come on the 13th day of menstrual cycle, and she visits. She comes 13th day, then 14th day and the 15th day. So the purpose to do ultrasound on these 3 consecutive days is to see whether the follicle is increasing in size, whether it is decreasing or whether it has collapsed. If it is collapsed and also there is the presence of free fluid in the pelvic cavity, it indicates that ovulation has occurred. The female cannot conceive until and unless she attains the required size of the follicle, which usually starts from 18 mm and goes up to 25 mm or slightly bigger than this. So after assessing these follicular size, now the gynecologist plans the ovulation therapy for this infertile female patient. Next, the common condition which is now common cause of infertility is the detection of polycystic ovaries. This condition occurs due to some hormonal imbalances and also easily detectable on ultrasound. Third, if the female patient is taking ovulation therapy for a long time, she might have a complication which is called ovarian hyperstimulation syndrome. It can again easily detectable on ultrasound. And we can inform the patient as well as the gynecologist in time to treat or to stop these complications here. Now in case of male patient, we do testicular ultrasound initially to see the size, shape and texture of the testes as well as the vascularity which is detected on Doppler ultrasound. And again the common condition which is the cause of infertility in males, it is the presence of varicocele which can be easily detected on Doppler ultrasound. So that's why ultrasound is the basic and the primary and the first line of investigation to screen the patient for infertility.
Okay, now we described in detail about how ultrasound helps in infertility treatment. Now can you explain about the how ultrasound helps in breast screening?
Yes, again ultrasound is the primary modality for breast screening, and I am very happy that the females are becoming more and more aware of the importance of ultrasound for breast screening. They come themselves and they demand that we want to have this breast ultrasound. Okay. So if the female patient comes to you and she has no breast lump, no swelling, no breast lump, but she has positive family history of breast cancer or any breast lesion, especially the breast cancer, we do ultrasound, and if there is no issue, we recommend annual follow-up. That you can come after 1 year, you are safe. And if the female patient comes to us with a breast lump in any quadrant of the breast, she is giving the history of breast lump, and on ultrasound we have examined that the breast lump is present. Now the task of radiologist is to see whether it is in the favor of benign lesion or in the favor of malignant lesion. So there are certain ultrasound features and characteristics which helps in differentiating this benign from the malignant lesion. Some important I can tell you. These are the height and the width of the lesion. The benign lesion is more in width, malignant lesion is more in height. Number 2 is margins. Benign lesion has smooth margins. Malignant lesion has spiculated or lobulated margins. And the internal echoes, these are homogeneous in benign lesions, while these are heterogeneous in malignant lesion. Parenchymal distortion, adjacent parenchymal distortion is seen in malignant lesions. So once the radiologist makes this thing clear in his or her mind that this is features are more in the favor of malignant lesion, then other modalities must be considered like mammography, like MRI. And also some referring doctors also prefer to do the CT thorax, abdomen and pelvis to see the extent and the spread of the disease as well. Number 2, ultrasound is also important in breast lesions to tell whether it is solid or cystic lesion. If it is simple cyst, not it is infected, there are again ultrasound features which can differentiate whether it is an infected cyst or it is a simple cyst. If this is simple cyst and it is very large in size, you can do ultrasound guide aspiration of the fluid. It will relieve the symptoms of the female patient to some extent. Okay. One thing, and next is this if the patient is going to have, sometimes the patient has just complaining of pain. So we evaluate this fibrocystic change. It is one of the cause of the pain, stretching of the muscles in the female patient. So all these abnormalities can easily detected on ultrasound. So I always prefer that before going to mammography, always come first for ultrasound breast. Next, the most important thing which I want to share with you, ultrasound is the primary choice, or it is superior to mammography in young female patients, younger than 30 years of age, because mammography again involves ionizing radiations. So avoid this as much as possible as you can. And second, very dense breasts. And third, because in very dense breasts, some of the lesions they become occult on mammography. So these mammography occult lesions, they must be first detected on ultrasound and then go for other imaging modalities.
So Dr. another query is, can we make use of ultrasound in trauma management?
Yes, ultrasound is the basic, and it is the first investigation in the patients who come with trauma or accidents. Whenever the patient comes in emergency department, of course these traumatic or accidental patients, they first come to emergency department. So the concerned emergency doctor immediately send the patient to the ultrasound room for fast scan. Fast scan is focused assessment with sonography for trauma. The task of radiologist is to detect the presence or absence of free fluid in peritoneal or the pelvic cavities, because actually it is not the fluid, it is the blood which is oozing from the injury site. So if there is no free fluid, if we have not detected any fluid, you can give time to the patient. You can comfort yourself as well as the patient. But if there is even a small amount of the fluid in the abdomen or the peritoneal cavity detected at the time of ultrasound, immediately refer the patient for CT scan, because it is the imaging modality of choice in patients with trauma or accidents, and it is helpful to just localize the specific site of injury. Number 3, CT scan also helps the surgeon or the referring doctor to decide whether this injury is going to be treated conservatively or some surgical intervention is required for this. So always whenever the patient comes in emergency with trauma or accident, immediately send first to the ultrasound room, then take any other decision.
So from what you said is ultrasound is very important for detecting.
Yes, it is the first line of investigation in most of the cases. Because then send the patient, because as I have told you earlier, because it is widely available, it is easy to use, and it is safe modality, safest modality. Of course, but in some circumstances, like for imaging of the bones, CT is the modality of choice, not MRI. CT is the modality of choice just for imaging the bones. Now MRI, I want to tell some advantages of MRI as well. Because it is considered as a higher imaging modality in radiology department. This MRI is again, it is free of ionizing radiation, but it employs a stronger magnetic field. So some patients are sensitive to this magnetic field, which we call in our language claustrophobia.
Okay.
Okay. Number 2, now MRI is superior to a CT scan for better soft tissue contrast. Number 3, MRI also it is better to differentiate between fat, muscle, water and soft tissue, superior to CT scan in this modality as well. Number 4, it is modality of choice in musculoskeletal system. Okay. Musculoskeletal system, which includes muscles, tendons and ligaments, and MRI is the only modality of choice to detect the tendinous and ligamentous injuries. So these are some of advantages of MRI. I always say that in radiology department all the imaging modalities must be carried out side by side, considering ultrasound as the first line of investigation. I again say first line of investigation. Okay. Then go for other imaging modalities if needed.
The important part of our discussion is, how is ultrasound useful in cancer screening?
Ultrasound is also extremely useful in cancer patients, especially I have told you earlier in breast screening. It tells the nature of the lesion, whether it is solid or cystic. If it is solid lesion and if it is giving the features of malignant lesion, of course we will not send the patient back to the home. We will send the patient to go for mammography, and if needed in some cases MRI breast, and then whole body CT scan to pick up any metastatic deposit. Okay. And whenever we see that, like in ovarian malignancies, if we have done this ovarian ultrasound and we something is clicking in the mind of the radiologist that is ovarian malignancy, then you refer the patient for CT pelvis, because it is the imaging modality of choice in ovarian malignancy, along with some lab correlation as well. And but again I will say that ultrasound has certain limitations in cancer screening, because it is sometimes very difficult to pick up the distant metastasis through this ultrasound. So we always send the patient then for CT scan or for MRI. It is the choice of the referring doctor whether he likes CT scan or MRI to detect the distant metastasis for the better delineation and characterization of this lesion.
So, doctor, is there need of other imaging modalities after using ultrasound?
Yes, as I have already told you, the ultrasound has certain limitations. As I have told you that for the evaluation of distant metastasis, we need CT scan and we need MRI. Yes. Yes, there are certain lesions. As I have already told you, in case of ovarian malignancies, CT pelvis is the modality of the choice. Ovarian malignancies. For remaining of the pelvis, MRI is the modality of choice. Now there are many, there is a list of fat containing lesions, but some few of, I will give you the name of few lesions like lipid rich adrenal adenoma, like dermide cyst, which is very common in females, and myelolipoma. The fat containing lesions, after ultrasound we refer the patient for MRI as well to have definitive diagnosis, because in MRI there is a sequence which is called fat set sequence. It is in simple words, it is a fat suppressed sequence. So all the fat containing lesions, when they have MRI and with this sequence, fat set sequence, the fat will be suppressed. There will be signal drop. Simple word, there will be black spot. So it gives a definite diagnosis of this fat containing lesion. It is extremely helpful in dermide cyst in females, which is common. And also in endometriomas, again a common condition occurring in female patients. Endometrioma, this again MRI gives the definitive diagnosis, because there is T2 weighted image, one of the sequence in MRI, which gives a specific sign, which is in our language we call it shading sign. Okay. So this shading sign is again definitive diagnosis of endometrioma. And of course for this evaluation of the whole body, we will go for CT or MRI, because we cannot do as a bone best detected on CT scan, soft tissue best detected on MRI. Okay. So we have the need, besides this ultrasound, we have the need of these imaging modalities in certain cases, not all the cases. One thing more, ureteric calculus, like uric acid calculus, it is not seen on plain X-rays. On conventional X-rays, we cannot see uric acid calculus. Okay, so we do ultrasound. Now in ultrasound, there is maybe the patient is uncomfortable, he is irritable, or lot of bubble gases are present in the abdomen. Specifically, the calculus which is present in the mid of the ureter, we cannot detect on ultrasound. So the urologist always refer this patient for CT scan, because CT scan has the quality that it can detect all sorts of calculi. Whether uric acid, whether these are MAP means magnesium ammonium phosphate, whether these are oxalate, whether these are simple calcium calculi, it can detect all types of calculi and wherever these are present, from kidney up to the bladder.
Okay.
So this becomes the so after ultrasound we have to refer these type of patients for CT scan. That's why I always say that all the imaging modalities go side by side, but first again is the ultrasound.
Okay, thank you, doctor. You described everything in very detailed manner about ultrasound.
Thank you so much.
Now, any takeaway message from your side for our viewers?
Yes, I want to give a very important takeaway message, and it is my request for all my specialist, consultant, GPs, doctors, that as ultrasound is the first line of investigation, so please always first suggest ultrasound for the patients before proceeding for all other imaging modalities, because it is easily available, it is safe, and it is free of ionizing radiations, and also most important thing is this, it is less expensive as compared to other imaging modalities. And also it helps not only in the diagnosis, but it is helpful in therapeutic procedures. This will, in case of therapeutic procedures, I mean to say that it is helpful to relieve the symptoms of the patient to some extent, like in pleural effusion, like in ascites, like in joint effusion, like in the presence of a large cyst which is producing discomfort for the patient. Under ultrasound guidance, you can aspirate the fluid and you can relieve the symptoms of the patient to some extent. So again, it is my humble request, please send the patient for ultrasound before going for other imaging modalities. Thank you so much.
Doctor, thank you for joining us and giving us detailed information about ultrasound and radiology. Thank you once again.
Thank you so much for inviting me and to share my knowledge with you and with all other common people. I am also grateful to you.
It's a pleasure. So viewers, I hope this was a very informative episode. It's time to wind up the show. This is Jasila Mujib signing off. Good night.
The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahla. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.